Welcome to Ortho Reports Podcast. Today, we're diving into a really fascinating medical case that shows us how surgeons can rebuild one of the body's most critical parts, even months after a pretty serious injury.
So let me ask you a question. What actually happens when the strongest tendon in your body tears, and then it just stays that way for months? The injury isn't caught right away. Well, that's the exact puzzle we're going to unpack today.
All right, let's meet the star of our show, the Achilles tendon. And this isn't just any tendon. It is, without a doubt, the heavyweight champion of our entire musculoskeletal system. It connects your calf to your heel, and it's what lets you walk, run, jump, basically everything. So when it goes, your mobility takes a massive hit.
Now here's the twist. This case isn't about a fresh tear. We are talking about a chronic rupture. And what that means, medically speaking, is a tear that's been left alone for at least 4 to 6 weeks. That delay, it changes everything. The tendon ends pull apart, scar tissue fills in the gap, and a simple stitch-it-up repair, that's completely off the table.
So, that brings us right to the patient at the center of this story. He wasn't just weeks out from his injury, he'd been dealing with this for 3 whole months.
Okay, so here's the backstory. We have a 61-year-old man who twisted his ankle. At first, it was diagnosed as tendinitis, and he even got steroid injections, which, by the way, can sometimes make tendons weaker. But he just wasn't getting better. He was in pain, couldn't walk right, couldn't climb stairs. During the physical exam, he had a positive Thompson test. That's a classic clinical sign. The doctor squeezes the calf muscle, and the foot is supposed to automatically point down. His didn't budge. That's a huge red flag for total rupture.
So, to get the final proof, the smoking gun if you will, they sent him for an MRI. And, sure enough, the images confirmed their suspicions. It was a near-total rupture of his right Achilles tendon. But the real problem wasn't just the tear, it was the space it left behind.
The MRI showed a 2-centimeter gap between the 2 torn ends of the tendon. Now, I know what you're thinking. 2 centimeters, that's not much. But believe me, in the world of tendon repair, especially a chronic one where the tissue is shrunk back, that's like a canyon. It's a huge surgical challenge.
With a simple repair impossible, the surgical team really had to get creative. Their solution was pretty incredible. It involved completely rebuilding the tendon using tissue from a donor.
Think about it like this. A fresh, acute tear is like ripping a piece of paper. The edges are clean, you can line them up and tape them back together. But a chronic tear, that's like the paper's been shredded, crumpled, and someone has glued a bunch of gunk in the middle. The ends are frayed and pulled way apart. It's a whole different ballgame.
And the key to this whole reconstruction was something called an allograft. Basically, it's tissue, in this situation a tendon, that's transplanted from a donor to the patient. It acts like a biological scaffold, a framework to build the new tendon on.
So you might be asking, why not just take a tendon from somewhere else in the patient's own body? And that's a great question. The huge advantage here is that you avoid a second surgery site. That means less pain, a faster recovery, and you're not weakening another part of the patient's body to fix the first, which is a really big deal, especially for an older patient.
The procedure itself was just a masterpiece of biological engineering. First, the surgeons went in and just cleaned everything up, got rid of all that gunk and scar tissue. Then they drilled a tunnel straight through the heel bone. They took the donor tendon, which they actually braided to make it even stronger, and threaded it through that tunnel. And for the final step, they did this intricate crossweave through what was left of the original tendon and sutured everything down super tight.
And the authors of the case report really highlight the beauty of this technique. They point out that this cross-weaving method isn't just simple to do. It also makes sure that the tension and the load are spread out evenly across the whole repair. And that is absolutely critical for good healing and for long-term strength.
But of course, the surgery is only half the story, right? The patient's journey back to full strength was all about a very careful, very structured rehab program.
And the results were frankly fantastic. Just 4 weeks after the operation, he was starting gentle exercises. By the 3-month mark, he was walking without any issues and could even do a heel rise. That's a huge test of Achilles' strength. A year out, he's back to normal. And at the 2-year follow-up, he had a complete range of motion and was walking totally pain-free. I mean, what an incredible outcome. And this wasn't just about how the patient felt. They had the proof on film. Follow-up imaging showed a perfectly restored Achilles tendon, no complications whatsoever. That donor graft had integrated so beautifully that it had effectively become a new, fully functional part of his own body. So what's the big picture here? Beyond this one amazing success story, what are the broader lessons we can all take away from this case?
Well, the authors spelled out a few key clinical messages.
There are really 4 big takeaways. Number 1, every surgery needs to be tailored to the specific patient and their injury. There's no one-size-fits-all. 2, using donor tendons or allografts is a fantastic way to get the job done without causing extra harm. 3, these specific techniques, anchoring to the bone and cross-weaving, create a super stable repair. And finally, and this cannot be stressed enough, none of this works without a great post-op rehab plan.
So the bottom line is this. Combining a donor allograft with this really clever anchoring and weaving technique is a safe, effective, and just a really elegant way to handle these super challenging chronic injuries. It gives patients their mobility back without the downside of a second injury.
And that really leaves us with a final, pretty exciting thought. As we get better and better at this stuff, at integrating donor tissue and designing smarter surgical techniques, are we looking at a whole new era of reconstruction? This case really suggests the future of fixing our bodies might just be this beautiful combination of biology and engineering. Thanks for joining us on Ortho Reports podcast.